What is a rhinoplasty? It is a surgical procedure that is performed on the outside of the nose. Why do people have rhinoplasties? There are many reasons, such as to help correct congenital deformities, nasal trauma that causes difficulty breathing, or causes a crooked nose. Reconstructive rhinoplasties are meant to help patients breathe better. On the other hand, cosmetic rhinoplasties are performed to change the size or the shape of the nose. What are the benefits of a rhinoplasty? Rhinoplasties can improve the appearance of the nose and the overall cosmetic appearance of the face. Additionally, rhinoplasties can correct cartilage and bone problems that can affect a person's ability to breathe properly. How are rhinoplasties performed? Rhinoplasties are usually performed under general anesthesia in an operating room. An incision is made on the bottom part of the nose called the columella. The skin and soft tissues are then raised off of the cartilage and bone from the bottom of the nose all the way to between the eyes. The cartilages are then separated from the nasal septum. The nasal bones can then be straightened or shaved depending on the patient's anatomy. The deviated portions of the nasal septum are then removed, and the surgeon can then reshape the nose by removing or adding cartilage, bone, or other tissues. Finally, the surgeon will close the incisions and will place splints inside the nose to help it heal properly. After the surgery, patients may experience some swelling and discomfort. There may be packing or splints inside the nose, and on the outside of the nose there may be tape and/or a cast to help it heal properly. You should follow your surgeon's instructions after surgery to help maximize your healing. Who are good candidates for rhinoplasties? The best way to determine if you are a good candidate is to make a clinic visit with a qualified surgeon. At your appointment, the surgeon will evaluate your history, medical management to date, and your physical examination. They will combine these with your breathing and aesthetic concerns to determine if a rhinoplasty is the right option for you. Additionally, they may use computer programs to show you what your nose might look like after the surgery. What tests can be performed to determine if a patient should have a septoplasty or a rhinoplasty? Your surgeon will first try to determine if there is another reason for the nasal obstruction. A CT scan or nasal endoscopy will help your doctor determine what other causes of obstruction might exist, such as large polyps, large adenoids, or allergic rhinitis. A rhinoplasty might be recommended if the outside of the nose deviates or if it is also crooked. Additionally, if the nasal septum is deviated in the top part or the front part of the nose, then a rhinoplasty may also be recommended. Some people can't sleep well at night because they can't breathe through their nose. In these cases, a rhinoplasty could potentially help them as well. Surgeons who are well trained in rhinoplasties are usually specialists in ear, nose, and throat surgery, plastic surgery, or oral and maxillofacial surgery. The information in this video is provided for educational purposes only. It is not meant to provide specific medical advice, so please seek professional medical assistance. The illustrations and content were created by Dr. Camacho.